All right, good evening, everybody. Well, welcome you here to the Plainfield Town Hall. At this moment, Anne is passing out some of the information that is going to be some of the early information talked about at the major public acts coming up this year. I'm sure there's going to be a lot more because this is some of the things that are leftovers from the end of the year and then starting over for this year. But we welcome you to the Plainfield Town Hall. I will do a quick introduction if you don't mind. So to my right, you have Representative State Rep Anne Dauphinais. To my left, you have State Rep Doug Dubitsky. And I am Kevin Cunningham. We are here for you because what we want to do is try to introduce what's going on with the legislature this year and be able to take your input on other things that might come up. So if you've heard things that are of concern to you that you'd like to talk about, this would be the time to do so. We do have a microphone set up here if you wanted to come to the front and speak, but if you don't mind, I'm just going to turn this over very quickly to both the representatives to introduce and say hello.
Good evening, how are you? I'm Representative Anne Dauphinais, so I have part of Plainfield. It's more of the north part. They took a little bit more away because we did the census last year and they redistricted the lines. So even the part that Brian Lanou had before is a little bit bigger. And now that will be Representative Doug Dubitsky. So we're here, it's very informal. You can ask any question you want. We may have the answers, we may not, but if we don't, we'll try to find them out for you. Okay.
Hi, I'm Doug Dubitsky. This is my first time here in Plainfield doing one of these town halls. I actually don't represent the town of Plainfield until January 4th. Very excited to meet people in Plainfield and learn about Plainfield. It's a lot different than my other towns. Currently I represent Chaplin, Hampton, Scotland, Lebanon, Lisbon, Canterbury, Sprague, Norwich, and Franklin. It's an enormous rural district that is actually the second largest geographically in the state. And now that there's been redistricting, I'm going from 9 towns down to 8, and I'm picking up Plainfield, which is by far the most populous town and also the most developed town. Compare this to somewhere like Scotland that has 1,700 people, and I think they have less than 100 businesses in the entire town. So I'm very excited to meet people of Plainfield, to learn about Plainfield, and to answer any questions you have of me about what's going on in the legislature, what's coming up in the next session, and I look forward to a good discussion here today. Thank you.
Thank you very much. If everybody was able to receive, if not, we might have 1 or 2 more of these booklets that were passed out. And again, these are suggested items for the end of last session and also the beginning of this session. So it's kind of a guessing game because you never know who's going to walk in and say, I've got some concerns and I want to put them on as a bill. So it definitely would be a great time for you to get your input of what's going on. If there's a concern for any bill, anything in particular. Obviously there's a lot of context in here. There's aging and banking, about the budget, children, families, criminal justice, economic development, education, higher ed. All of those things in there are definitely important. We want to make sure that you are included in that. This is where it starts. It's a town hall meeting because we're looking for your concerns, your input, maybe some thoughts and ideas that might help out, whether it's regional or whether it's for the state. So if anybody has any items that they'd like to talk about, this would be a great time to do it. You can come up to the microphone, just a quick introduction, and then start off. Don't be shy. This is a wild guess, but this has something to do with education.
Hi, good evening. I'm Kristen Haskell. I'm Board of Ed Chair. I've worked with Anne in the past. We are here basically tonight to say Plainfield recently, during the pandemic, was notified we're now an alliance district. Increase of mandates, but no funding. Currently, we are receiving 0 alliance funding. It's slated to begin, but it's been pushed back before. We really want to see that. I'd like to see us get funded.
Sure, if I can speak to this. Hi, I'm Paul Brenton, I'm superintendent of schools. I actually met you when I was working in Killingly. Welcome to Plainfield. The alliance districts are funded on a formula that's based on a 2017 formula. That formula for alliance districts only accounts for the original alliance districts that were part of it. Since that time, there's been some riders that have been added to bills. Both Groton and Thompson received some funding. Recently, Stratford received funding. There's 2 towns in the state of Connecticut, Plainfield and I believe Enfield are the only towns in the state of Connecticut identified as alliance districts that have alliance district requirements that are not receiving an alliance grant. For us in the town of Plainfield, we're still running interventions and other pieces through our ESSER grant. That's a grant that's set to expire in 2024. Just north of us, you have the towns of Killingly and Putnam, both receiving over $300,000 a year in alliance funds. You have Thompson just north of us receiving alliance funds as well in the northeast corner that are in your district. However, we are the only one not receiving any alliance funds. So that's something that you'll hear us repeatedly speaking to. We're happy to meet with you and identify the needs the schools have and speak to why the 2017 formula, which made a lot of sense in 2017 for the initial 30 districts, no longer applies to the current 36. But thank you.
A quick question for you before you go. You mentioned the 2 towns that didn't receive anything. Was there any numbers associated initially as to what you should have been getting?
So what had initially happened, thank you very much, was that a formula had been applied to the alliance grant, which had said we will give you an increase in ECS funding, putting it to a previous number. Many things happen before things are adopted. In the 11th hour, that money was lost as well. So the ECS number was not adjusted last year. It is scheduled to be adjusted this year. However, north of us, Killingly, Putnam, and Thompson, in addition to that ECS adjustment, are receiving an alliance grant. We ourselves, this last Wednesday, had 2 members of the State Department of Education visit our schools and tour our schools. The point of these tours is normally to see how your alliance funds are being applied. We have no alliance funds to apply, so instead we just showed them the hard work that our people are doing and what our students are doing. And they told us they left impressed by the work that we're doing. But certainly I will advocate anytime I see anyone who volunteers their time in the state to give Plainfield an opportunity to have the alliance funds that all other alliance districts receive.
Would you mind doing me one favor, just for the audience's information, explain that what the alliance really does and what it's X amount of years, and it's supposed to be static with your monies as well, but could you give just a little bit background for the public?
Certainly. So in 2017, I believe, right around 2015, 16, 17, the state of Connecticut identified initially 33 alliance districts that also contains the priority districts. These districts contain more than 40% of all free and reduced lunch students in the state of Connecticut. These were identified as the neediest towns and districts based both on demographic and on test scores. In that initial piece, Plainfield scored about 36. Plainfield still scores about 36. However, 3 of the towns that were receiving funds now have had their scores increased. So that brings Plainfield to around 33rd, which now qualifies us as an alliance district. However, based on the funding, we are not receiving alliance funds. The state hosts alliance symposiums. They bring in alliance speakers. All of the alliance offerings that the state has are really ways in which the state will assist the community in finding the best ways to spend their alliance funds, which I will stress again, we don't receive.
Thank you very much. And I know it's tough because you've got the requirements to bring the grades up through the alliance process, but they don't give you the money, and that puts you you're behind already. So thank you.
Thank you.
What is the factor within the formula that's preventing them from giving Plainfield money?
two factors, I believe. I can actually send them to you afterwards in an email if you'd like. One of them is the date at which they're using, because the dates are based on the original legislation. I think additionally there is language within the legislation that speaks to refunding things at a particular level. So if the legislation says we will hold funding at the level of 2019 or 2018 or 2016, or we will increase every town funded in Alliance 3% from their 2019 numbers, our 2019 number is 0. So for Groton and Thompson, those two districts have a special fund outside of the Alliance Fund. It's a special grant that they're given, which solves that equation for them. And those are all right here up and down the 395 corridor. We were not given a special fund.
Now, in 2019, your funding was 0. Was that because you weren't an Alliance district at that
Correct.
time? So any new Alliance district essentially gets nothing?
I would say yes. However, there were 3 new Alliance districts that were added in the last legislative session, and one of them was funded. However, we in Enfield were not.
What year were you designated Alliance?
Just last year. This is our first year as an Alliance district.
All right. Thank you.
Thank you so much for your time, and thank you, Mr. Cunningham, for your questions.
All right, very good.
Did someone specifically tell you that you weren't going to get it? Have you gotten any response?
The current legislation does not contain any language that would have Plainfield funded.
Okay. Thank you.
Maybe State Board of Education might be a better way to reach out.
When I speak to the State Department of Education and I speak to anyone at the CSDE, they tell me I need to speak to my elected officials because this is all in legislation.
Well, this I think is very helpful because now you've got the ears of these people that'll help out to start the initial conversation. So is there anything else that you need?
But we happily invite you, especially representatives of Casino, that you're new to Plainfield, to come in and learn about our schools. This Thursday is actually a debate going on about Plainfield High School. They're holding their first annual, hopefully, debate, which is bringing in other communities as well. So it's a great opportunity if you have the chance to stop by over at the high school.
Thursday, what time?
It's from 2 o'clock to 8 o'clock tomorrow. A great article by John Penny in the Norwich Bulletin this morning on Plainfield High School.
2 o'clock to 8 o'clock?
Correct.
So Lincoln does.
We have 10 different schools that are coming, and we think it's the first regional debate competition that's been held in a very long time. Our staff's worked hard on it. We're really proud of Plainfield High School, and Plainfield Teacher of the Year, Kevin Mariano, former Teacher of the Year, will put it together.
That's at the high school.
It's at the high school.
If I can make it, I will if I can.
Thank you so much.
Thank you. And any further update, I'll make sure we all hook up with emails so that way we can be in touch.
That's always thank you.
Thank
I
you.
will give you my card. Thank you, Larry.
So for those in the audience, again, this is something that affects all of us. It affects all of us because of the education is part of your budget, and you're trying to make sure that you have all those pieces together to come into work. So we have a working budget, something that works for the students, and also works as support for the taxpayers. So that's just one item. Does anybody else wish to come to the microphone and say hello? Come on up. It's very informal. All we ask is that you just give us your name so we can, in case we need to get in touch with you later on.
Excuse my look, work for the more work, so I'm Jim Zinzak.
Awesome.
What's that? Just a quick question about education. So I used to be in education about 20 years. I was an admin level director, ran an IT department. So the biggest problem I've had in education is we go forward to talk about testing and funding. Why don't we try to think outside the box like STEM schools do? Instead of maybe trying to make partnership with businesses and do OJT. Some type of scholarship program where kids can do welding and they can do engineering and I'm from an inner city school, one of the programs like computers and going further. And if you get outside funding from businesses that becomes a partnership, it's something to think about. I keep thinking that's why it's always been the mentality. It's terrible. It's terrible. And it's not testing, as you know, testing you teach for a test, you're not learning. There's no critical thinking. And then until you put all this new math in it, there's no critical thinking. You know, where you can get people to get educated and work with their hands at the same time, well, it's a pretty good combination. Not everybody likes books, but some people like to work. So, I don't know if we ever, you know, anybody in the areas ever start to think about that or start talking about it, but maybe it's a good time. There's no one, you know, let's not kid ourselves. And, you know, I mean, we're not stupid people, right? I mean, it's like, maybe we find something better for the kids.
Appreciate your input. You do know that we do have the two chairperson for the Board of Education right here and our superintendent, so that would be a great introduction to talk about different things that might be
Yeah, I'd love to. I mean, I came from an environment that did that and it was very successful.
You said you work in IT?
Yes, I do.
We can absolutely talk.
You know, I'm actually in the PMO. I'm part of project management now, but yeah, that's for like 20 years. Network engineer and you know, IT.
So Jim, just be careful because he asked if you worked in IT. And there's a background question there for you later on.
It's good. It comes with the territory. That's why I dress like this. Nobody asks me questions.
Thank you very
But
much.
yeah, I mean, I love having an open discussion because I want to hear the why we can't.
Okay.
Right? I want to hear why we can't do it. So, thank you.
Thank you. Anybody else wish to come up to say hello? Hi, Madeline.
Madeline Priscilla. I just have a question about insurance coverage for people who retire but are not old enough to get onto Medicare. And I think it probably would not have come to my attention except get home with a daughter who has a serious health problem and has suffered for a couple of years. She needs surgery. She thought she had good insurance, but the insurance does not cover what she needs. And it seems like, well, as she put it, there seem to be scam insurance companies out there that are collecting huge premiums, but every time a person needs medical care, the insurance company won't cover it. And that's the predicament she's in, and my heart goes out to her. And other people, it makes me realize a lot of other people in this situation are really suffering and need health care. And I was just a little encouraged. It looks like some of the representatives in the paper this week, one from Rockville and one from Middletown, apparently are on a commission that's going to look into this. But it's a very serious problem. And I know the health care in that age group is very poor because of what I call insurance scams. And she has spoken to many, many people and just can't get any help. And I think people are suffering needlessly. And I know the paper alluded to poor health care because people are obese. The American way of life reflects poor diet, lack of exercise. But that's not always the case. I know that is a problem in our country, but that's not always the case. You know, hers is an orthopedic problem. And there are many situations where people take good care of themselves, have good health habits, and they need help, and they can't get adequate health care until they get on to Medicare. And I was just wondering if these people are serious and they're really going to look at this problem.
Do you have that? Mind if I
Yes.
even get a copy of it later or just take?
You can have it.
Thank you. Is that would help out to?
I just like to know if people are really serious.
Yes.
So I think Representative Dubitsky and myself are not on the insurance committee. The insurance committee and insurance is very complex, and unfortunately, we don't have a competitive opportunity in the state, and most states don't, with health insurance. So there's kind of a one-size-fits-all, and oftentimes more mandates and regulations that we put on insurance companies drives premiums up. So a lot of these things play into that. I don't know about this specific issue. We will have to find out for you, and we can. But if they're on the insurance committee, they probably are serious about looking into it, I'm sure. Yeah. Yeah, and I can tell you if we hear anything or understand anything beyond what you explained, we'll let you know.
I would appreciate it.
Yeah, sure.
Keep walking years of
Okay.
It's a long, long story that I don't want to it's serious.
Okay.
Thank you.
Thank you for that information. Your bulletin. Yep. This is helpful, Madeline, because now we can start reaching out to these people to get more information from them, so thank you for that. Anybody else?
Evening. Kevin, I'd like to thank you for putting this together to begin with. It's nice to be able to reach our representatives. I'm Don Gladding. I'm former First Selectman. I live in Moosa, town. A couple of things. I'm one of the two representatives on the Northeast District Department Board of Health. One thing that we found in our discussions with budgets and all that stuff is that it seems like traditionally the state has underfunded the Department of Health, all those districts. And so what that winds up being is that if the state doesn't submit enough money coming to our, allocates money to our district, we wind up having to either increase our fees to different contractors that do septic systems or whatever, or increase the per capita tax to the town. And so I just want to, when you're putting the budget together here in the next few months, consider that the state really needs to help fund the district departments of health around the state. The second part of my dissertation this evening, I'm talking with several people the last few weeks. Some of the feedback I get is with our electric rates, and they affect everybody. I understand that Eversource is going to double their service fees from 12 cents to 24 cents per kilowatt hour starting in January. With the increased inflation of cost of everything going up the last few months, one thing that we were talking about at the meeting I was at this morning, the state mandates that if you don't choose an electric supplier, it automatically defaults to Eversource's rate for service. That's in Eversource's section. I assume it's not illuminating down in the southwest is similar. So anyways, we were talking about it's right now 24 cents. There was one company that was suggested today that it was 16.3 cents, I think, a kilowatt hour. But anyways, one of the things that was discussed because of that mandate or that default system that's set up now, it's set up legally through legislation, that if you don't apply for a rate with some company, it automatically goes to Eversource. It seems like the state could delegate or a bit of a default system where the electric company like Eversource or the Department of Public Department of Rate, whatever the utilities are adjusting to. Anyways, they could set that the state would require Eversource to use the last three averages of the lowest provider's fee. Would that be the default thing? So they could put that into legislation that would keep the rates down and helps, especially seniors, and a lot of them have a hard time figuring out on a computer or the call or whatever to adjust their rates and stuff. So they were going to give a big hit because they're paying a higher rate right along rather than able to adjust their own. Just something to think about. Maybe you can work with the people, whoever does that utility authority, to adjust the rates and keep them level down. Thank you.
Thank you. I know the rates are very difficult at this time, and I think that that's something that could be looked into. Obviously, Pura has some control. What my concern with trying to put something together like that, and not that it's a bad idea, but I think there's some issues there with some of those things are lock-ins. So if you try getting out early and it's a low rate, you're penalized. Some of them are buy-in fees as well, so that's another problem. But I think it's something that could be looked at in the future to try to figure a better way.
I understand the state laws now say that if you have a contract with a provider for 3 years or whatever, there's no get-out penalty. A lot of places, contracts have a penalty if you get out of the contract, but I understand Connecticut law doesn't allow that.
So what I'll tell you is probably one of the number one questions I've had in the last 3 or 4 months is about the electric rate. So I'm in the process of working with the staff up at the State House to have actually a presentation so that everybody can come and ask questions to try to understand it better. One of the issues, again, it's about competitiveness. You know, Eversource is the only one that we have over here, so there's a lack of the ability to be competitive. There's 2 parts to the electric bill, I know too, and it's been explained to me, and I've spent hours trying to understand the Eversource bill, but there's delivery and there's supply, and Eversource buys their power in January and in July. And whatever they buy their power at, they sell to us at that cost. So if they buy it at 7 cents, they sell it to us at 7 cents. So I'm assuming that Pura approved it because that's what they bought it at. I don't know, but that's how I understand it. The other side is the other part of your bill, which includes all the labor, all of our supplies, all of the subsidies that we provide, and we have lots of subsidies. We have a lot of mandates or regulations that are costly to the ratepayer as well. So it's complex, so I'm working on getting a forum together so that people can come, ask questions, and maybe get more information to try to understand it better. But it's a problem for you, and it's a problem for us, because we all have electric bills too. And I could pay a mortgage for what I pay for electricity. So it's very high, and we're sympathetic to that. So we're up there asking the questions, and I will try to put something together that will hopefully answer more questions for all of you.
Thank you.
Our electric rates are much higher than they are in most other states. And that's because the legislature wants it that way. They have the power to change it, and they don't. It's just that simple. You know, they could easily change the way the system works, as other states have, but they won't do it. I have introduced the bill for a number of years, trying to get a study about increasing the availability of municipal electric and other utility companies, like Norwich Public Utilities runs an area around Norwich. There's one in Groton. There are several around the state. And they have much better customer service, much lower rates, much more reliable, at least if you ask the people who live in those areas. I got that bill through the House last year. It wasn't even called in the Senate. I'm going to introduce it again this year. I doubt it'll even make it through the House this year. If you want things to change, you got to talk to the people who can actually change it. And that is the people who are in power. And Anne and I are not among those. So the reason why the rates are the way they are is because the party in power wants it that way. And all efforts to change it are completely dismissed year after year.
Well, and I think, you know, what Representative Dubitsky was speaking to is we have no competition, and the legislature doesn't support the bills that we try to put through to at least study that and offer competition. So it is an issue, and we're trying, but maybe if it comes up in committee, his bill came up in committee because it passed committee and then went to the House. Write letters, get people to come up and speak. Those things are very, very powerful and helpful.
Can you guys post those numbers on social media to start call?
The numbers of the
Yeah,
legislature.
who do we call? Who do we call? What legislation do we call? To start?
Is there a link that we can actually get?
So, yes, there is. And there, we don't know who the committee chairs are going to be yet, but that'll all start up in January. So those are the specific people to reach out to. And we will be finding that out. I know they're in the process of making those decisions. Our session starts on January 4th, and that's something I can speak to for just a couple of minutes. We're going into each term is 2 years, and we're going into what we call the long session. And it's supposed to be working through all the ilks of the budget and, kind of working all of that out. And then the next session is supposed to be the short session that just kind of fixes the maybe things that issues that need to be fixed in the budget. So we start January 4th, we go to June, the first week of June, and then the following year we start the first week of February, and we go till May, the first week of May. So that's kind of how it works. But we will try to get you those links, and you will, once you know who the chairs are, those are the people to reach out to. But if you follow those bills that come up, every year they have a different number, so when he puts in his bill, it'll have a different number. You follow the bill, and when it comes up for hearing, those are the opportunities to get your friends and family and people to testify and, make a stink about it. That's helpful.
Just want to clarify something. There is no short session, there is no long session. They're always receiving calls, talking to people, trying to get information. So like tonight, it's not even in January, and we're talking about things that could come up. So these people are available all year round, so if you really need to get to them and ask them what's going on, you have their information to get to them. You've both been, unfortunately, up against some battles with the budgets that sometimes extend into almost October. So that puts the towns behind the 8 ball, because now we're trying to put a budget together, which we don't know, verifying how much money we're actually getting. I mean, Board of Education is putting numbers there and saying, I'm hoping we get the money. I'm hoping that what they said was correct. But that does happen sometimes, so they're working throughout the year.
As are you.
Yeah. Does anybody else have other concerns or questions?
Art Gaggy, another energy question on the clean energy program expansion. The third item increases the proportion of SCEF projects that must benefit low-income customers. Could you explain how that benefits low-income customers? It's on page 9. Thank you.
It's that first paragraph.
Yeah, the clean energy program expansion. Right at
So
the end.
Item 3 says increases the proportion of SCF projects that must benefit low-income customers, and there's looks like an attachment for a bill. Most provisions effective October 1st, 2022.
So how does it benefit low-income customers?
I haven't seen the budget for that, but I'm assuming that there's more provisions made for low income with regard to some of the programming in here, like it mentioned solar projects. And I haven't seen the latest solar project that they're offering, but all those solar projects are subsidized by the taxpayer. So I'm assuming that, and I don't know because I'm not on energy, that those programs, there's probably more provisions made for lower income with some of those programming.
As far as on your house, solar?
It could be. I know that they were going in and wrapping pipes and looking at your energy bill, and there was like a package where they'd actually come out to your house, and I think it was specific to people that fell under a certain income bracket, and if that may be the project that they're still talking about, and I'm not sure.
That would be the shared clean energy
It
facility?
might be, yeah. But
That's
they've
what they're
had
talking
several
about.
programs that kind of, what happens a lot of times too is we'll get a program, and then they'll come up with another program, and then another program, and before you know it, there's several programs trying to run out of using a bucket of funding, and it gets complicated, and quite frankly, it gets really expensive, because every program needs its own administration, its own people running it. So I know both, I can speak for Representative Dubitsky and myself, it's so cumbersome that it gets costly. So a lot of times you'll see us vote no, but we already have several programs out for several things, and we keep adding on and adding on and adding on. And they sound good, but they get complicated and they get costly. But I'm getting a little off track here, but I think that's what they're talking about. So I don't know what specific program they're talking about.
Well, both of these programs are essentially large industrial programs for bigger projects, big solar fields that serve a given community, and things like that. And we're not talking about solar panels on people's houses. The shared clean energy facility is, and I'm not on the energy committee, but my understanding is it's a facility where, I don't know if you know the solar field in Franklin, and there's one in Norwich, you know, there's one going in where is it, in Hampton. You know, there's several of them around. There's a big one in Brooklyn and Canterbury. It crosses the line. And what those do is they essentially put power directly into the grid. And then there are contracts where the different people get money based on how much goes in the grid. And there are projects like these projects that is supposedly to provide energy to a given community. And you know, in this instance, it may be a low-income community. You know, I'm sure you've heard very often when they talk about generation, they say, you know, it generates enough power to power 300 houses or something like that. Well, when they draft these contracts, people can, not only people, but individuals or apartment complexes or bigger facilities can take advantage of those contracts and can make contracts with Eversource or UI and buy power that supposedly comes from these fields. Even though electricity is fungible, once it goes in the grid, it goes everywhere. But they keep track of it, and they say a certain amount of it is going to come to a given facility, and they're buying green energy. Hope I answered your question.
Absolutely. Yeah.
Just trying to find the bill online. It's very complicated. In case you wanted to know a little more about it, that says Public Act 2214, but if you look at it's a substitute Senate bill. Great questions, great comments. Anybody else? And again, this is something that affects all of us. All of these items do. This is a great time to ask a question about what's going on.
What committees are you currently looking to serve or know that you're going to be serving on?
So I've been on the Public Health Committee, and I have been on Children's, ranking on Children's, and last session I was on Transportation, and I did request to switch that, so I don't know. We don't know if we'll be on those same committees, so we put in our requests, and then whatever the need is, we get shuffled around. So I have in the past been on Human Services, I've been on Housing, I've been on Public Safety, which I really enjoyed. So we don't know. Appropriations, I've been on Appropriations, so I don't know which one that we'll get on. We don't know yet. They're kind of doing that shuffle.
I'm pretty sure I'm going to be on the same committees I was on, or I'm on currently, which is Judiciary, Planning and Development, and Environment. Judiciary deals with obviously the court system and criminal laws and things like that, and anything that relates to that, such as if you change the way that the civil court system works. It goes to the judiciary. If you change penalties, any law that has a penalty of any type, so anything that has a civil fine, anything that has a criminal penalty that could be imprisonment or a criminal fine or things like that, that all goes through judiciary. Very often changing what people are allowed to do. Anything where there's a restriction on somebody's behavior or a restriction on somebody's rights, that all goes through judiciary. We also interview and confirm all of the judges. Every 8 years, every state judge is up for renewal, and when there's a vacancy, the judge nominates, and initially the Judiciary Committee will hold hearings on the judge, on new judges, and we'll vote on them. If they clear the Judiciary Committee, then they go to the full House and the full Senate for votes. The Environment Committee is pretty self-explanatory, except that we also deal with anything that relates to animals and farming. Also goes through the Environment Committee, as in addition to things you'd imagine, pesticides, clean air, clean water, and planning and development deals with anything that relates to municipalities. Municipalities are subdivisions of the state. They are essentially created by the state of Connecticut, and they only operate by virtue of state law. So anytime the legislature wants to force a town to do something or prohibit a town from doing something, that goes through Planning and Development Committee. So for example, one of the big issues in the last 2 legislative sessions was affordable housing, and how there were a group of people who wanted to force every town to have a certain amount of affordable housing based on a definition that small towns cannot satisfy. And that went through Planning and Development, as I'm sure that will be up again this year. There's a law called 8-30G, which is the law that that statute and the statutes all around it in the statute books essentially require every town to have 10% affordable housing, and it creates a definition of affordable housing that, if you'd like, I can go into it, but it's essentially something that small towns with no services, no water, no sewer, no transportation, they simply can't satisfy. That is going to, again, be an issue. It is every year. There's big fights over it, especially with regard to small towns, because the academics, especially from Yale University, want to penalize all the towns that don't satisfy the 10% requirement, and there is not a single town in the state with less than 7,500 residents that satisfies it at the moment. So it's a very difficult situation, and that is one of the things that goes through planning and development on which I sit.
So Representative Dubitsky said something that I think is helpful for everybody to understand. This side of the state is very different than the other side of the state. So he was talking about our towns, our small towns here. We always say on the east side of the river. So when you look at towns, or you can call them cities, like Hartford, Bridgeport, Waterbury, New Britain, all the bigger cities. Some of those cities have 4, 5, and 6 legislators that represent them. If you ask Representative Dubitsky, he has 9 towns. He's one legislator that has 9 towns, so that's 1 vote for 9 towns. I have 3, and many of us have, 2, 3, 4 towns. So it's very difficult because a lot of the law that's made and bills that are passed are designed for those specific towns, and we're very different on this side of the state, and we make that argument all the time. It's not a one-size-fits-all, and it's a real struggle for us on the east side of the river. And so we're constantly trying to make that argument with anything that comes up. So whether it's how our schools are run, how our hospitals are run, how our planning and zoning and planning and development is for our small towns. So it's an uphill climb, a constant uphill climb. So there's less of us fighting for a big part of the state that's very different than the other part of the state. And I just wanted to mention that that is a big challenge for us.
Thank you very much. Other comments or questions? Anybody?
Question for Mr. Dubitsky. Are you familiar with the group One Standard of Justice?
One Standard of Justice?
Or have you heard about the Paid in Full campaign that's probably to be submitted to the Judiciary Commission this year?
Is there a specific proposal?
They're working on it. It's something I would rather not talk about publicly, and maybe if you have a minute after.
Sure, I'd be glad to talk about it. Yeah, make sure you grab one of my cards that has my information on it. And one of the big issues that has gone through the Judiciary Committee and is likely to come up again is the issue of solitary confinement. I've done a number of these town halls over the years, and very often there's somebody who brings up the issue of solitary confinement and how it should be used, how it should not be used. We regularly have bills about it, about how if a given inmate is violent and dangerous and a risk to other inmates or the staff or the guards, that the facility very often uses solitary confinement either as a punishment or as a way to isolate the person from others so they can't do injury to them. And there are a number of legislators who believe that is inappropriate and that they should receive counseling instead. So that's one of the things that bounces around a lot in the Judiciary Committee. There was even a few years ago one of the legislators who is looking to completely ban all solitary confinement, brought in a mock-up of a jail cell, brought it into the Capitol, and people could go in there and have the door closed, and they could sit there for 5 minutes, and he felt that that would convince people that solitary confinement is inhumane and that people should not be put in for any reason. I know that year we did considerably limit how solitary confinement could be used, but I think that if it were banned completely, just about every prison guard in the state would quit, because and they were up there in force, arguing that they only use it when necessary to protect other inmates and to protect the guards. So that's one of the real tough issues that creates a lot of tension up there. And I'm sure it's going to come up again this year, that somebody's going to talk about it. I know there was a recent court case somewhere in the country that dealt with solitary confinement that will no doubt be brought up and incorporated into a bill somewhere this year. And we will address it in the Judiciary Committee. But I'm glad to talk to you about whatever your issue is.
You know, one of the things Representative Dubitsky brought up, looking at those sorts of things, solitary confinement and that sort of thing. There's been a big push in the legislature to eliminate criminal records, decrease your ability to have a sentencing, whatever the crime is and what fits the crime. And we've seen a huge push over that. I mean, I've only been there 3 terms, but from the time I've gotten there, to decrease or minimize consequences for criminals that they're getting. And so it was on the news recently because they're pushing to move that along and get these records erased. So there's a lot of that going on now, and in a lot of ways he talked about the solitary confinement. We take away a lot of times tools away from the very people that are protecting us, those that work in the prisons. We did it with the police accountability bill. We took a lot of their tools away that made it much harder for them to do their jobs and actually made them much more unsafe. And until you really listen to the floor debate, you don't really get the nuances and all the detail of the things and the changes that are happening. That's why it's really interesting to listen to committee hearings as well, because police will come in and testify, correction officers will come in and testify, and they'll give you examples of what happens on the job and how those things impact their job. So if you get an opportunity, go on and listen to some of the hearings. They're very, very interesting, and you just don't get that when you get the bill in front of you and you vote on it. People say, well, why did you vote on the bill, or why didn't you vote on the bill? There's so much that's missed in those committee hearings and the floor debate, and I just wanted to share that. He brought that up about solitary confinement, and we heard a lot of arguments from correction officers, and it's one of the tools that they have. So those sorts of things, we're really pushing that in Connecticut to minimize those things, and it's really putting us, I think, in a lot of ways, in a lot of higher risks in the people that are doing the jobs as well. So.
Okay, thank you. Other comments or questions, anything?
I actually have one on public health. Not related to the school system, this is me personally. Since 2016, I've been battling lymphoma. As of October, I was diagnosed with a secondary cancer. And one of the things that we actually learned recently is that even though I have to travel to Boston monthly to see a specialist, there's only 2 in the United States who can specialize in this specific immunocompromised condition. They're not allowed to provide telehealth services. So I had to travel to Boston on our own, transportation costs to get 1 prescription written because he could not see me telehealth because we live in Connecticut. Now, my other choice was to travel to A&M in Texas, and that was not happening. I'm lucky enough that I live in New England and have access to Sloan Kettering in New York and Dana-Farber in Boston. But anything that you can do to expand that out-of-state providers, currently it's for behavioral health services. But if you're a patient and a cancer patient, sometimes it's as simple as getting a hold of them to say, hey, I need a med switch, or I need more Zofran because I can't hold anything down and it's been 3 days and all the ER can do is give me an IV of fluids. It's that simple of them to be able to pick up and call in, but sometimes they have to have a conversation with you. I have to travel to Massachusetts. Now, I could drive my car over the border to Webster, set up something in my car, and they can prescribe to me. But I'm blocked from being able to be prescribed here in Plainfield when I'm home.
So I'm a big supporter of telehealth. I was before COVID, and I am after COVID. And I think that's a decision that the patient and the doctor need to make together. If the doctor thinks he needs to see you, then he needs to make that call. But if he can do do it, telehealth, I'm very supportive of that. I think that that should really be up to the doctor to decide. So are you saying that you can't, they couldn't do it because it was out of state?
Out of state.
Because I know we've been also pushing for it and supporting that and extending what they did during COVID. So
Yes, yes.
I will look into that. I mean,
And
I
I'm
would be,
happy to come up anything regarding
Yeah.
cancer or anything to testify. We run into quite a few issues being Connecticut versus being treated in Massachusetts. We're lucky that we have great health insurance, but it could all change in the blink of an eye. And my generation, I was 32 when I was first diagnosed. We're the fastest growing population of cancer. We're finding more and more that's coming. I don't know what else to say besides that's a huge imposition to be able to have to travel to Boston for as simple as 2 seconds. Here's your script. Go get it at the pharmacy. Go, go, go.
Right.
You know?
so I'm supportive of that for cancer patients and any patients, quite frankly. So I would be supporting that, and I will bring that up because I'm hoping that Senator Summers is still on the committee because she's been ranking for the Senate. So, and then, as you know, Doc Pettit didn't run again, so we will have a new ranking member on public health. So those things will be changing, but I would be advocating for that.
I was thinking that perhaps that's some type of federal issue, being across state lines, because in Connecticut, I know that we passed a telehealth bill 2 years ago, and as long as it, you know, I have talked to my doctor via Zoom and certainly on the phone, and you know, you hear commercials all the time for, you know, if you want Viagra or something like that, you just call this number and you get some guy in Bangladesh, some doctor, and they'll prescribe it for you, and you can go online and get it. So there certainly seems to be a way that
My understanding is his patients in New Hampshire, he can visit and do telehealth. His patients in Connecticut, he is not able to. So it's
Now,
something
are you
that-
sure it's not the facility in Massachusetts that has a policy against it?
I don't believe so, but I can certainly look into that.
Yeah, you might want to ask him, because I have a feeling that might be the case, because I know in Connecticut, telehealth is widely available, at least
And it
within
could be
state.
something specific to cancer. It's just to be able to travel back and forth to Boston. And it's not the first time it's happened to me in the past 4 or 5 years. I travel monthly. I have to go for immunoglobulin treatments because they can't do them in Connecticut, but I can get them done in Massachusetts.
Well, I'm sorry for your condition, but I do think you want to talk to them and see if it's their policy or if it's something in Connecticut state law. If it is, certainly we'll take a look at it, but I have a feeling it's not.
Yeah, if you can get those specifics and let me know,
Sure.
that would be helpful. We'll know what direction to go.
Thank you for that. Are there any other comments or concerns, questions, ideas? Are you going to be doing another one of these series later on?
Yeah.
Okay.
I try to do them once a quarter. It really slowed down during COVID, but we try to do them once a quarter, and we try to do them together. Sometimes the senator's here with us, sometimes it's just one of us, sometimes it's all 3 of us. I'll just give you a quick overview. So we'll be starting in January. Committee hearings will start. We'll take our prospective committees, and they will be bringing forth bills. Again, that's the majority party that decides which bills are heard. So there's literally hundreds and hundreds and thousands of bills that are submitted. The chairs of the committees decide which ones get heard, and then the majority party decides which ones are going to come out of committee, because it's by vote, and obviously we're in the minority. And then again, they go to the House and to the Senate, depending on whether it's a House or Senate bill. And then the majority leaders decide whether they're going to be heard on the House floor or the Senate floor. And then if they get heard, then those majority leaders decide whether they're going to be heard on the other, from the Senate or the House. So there's quite a process that takes place to get a bill from step 1 to across the finish line. So if you have any questions about that, ask too, but that is kind of what will happen. Each committee will start having deadlines, and they start as early as, I think, March, and they'll go through like mid-April to 3/4 into April, where each committee, like I think Judish is one of the latest committees to have deadlines for getting the bills. So each one is different, like Children's is one of the first. Public Health is usually kind of in the middle towards the end. So each committee is weighted a little bit differently too and given different dates. So if you have questions along the way, if there's a committee, if you see a bill come through and you have questions and you want to come testify, please do so. We're not sure if hearings are going to be Zoom this year or if they're going to be live. We still haven't been told. That's really decided again by the majority leaders. So that'll be another, decision that will be made shortly. Anything else you can think of?
Our first day in the legislature this year is going to be January 4th. We have a deadline to submit all of our bills. It's either going to be, the 4th is Wednesday. The deadline is either going to be that Friday, which is the 6th, or it's going to be the following week on Friday, which is the 13th. We haven't yet been told which it's going to be. Very often what they'll do is in a long session, which is what this is going to be, they'll give you the extra week. So our first day is 4th, our bill deadline is the 13th, typically. But it could still be the 6th. And what it means for a bill deadline is that we have to have all of our proposed bills submitted by that day, meaning that we have to have them all drafted, vetted by our partisan staff, which is, for us, it's the House Republicans. We have to have our bills go through. They have to be turned into legislative language. And then they have to go to the nonpartisan staff, which is the Office of Legislative Research. And what they do is they take our bills and they change the language around to make them fit within the statute structure of what's on the books now. And then they send it back to us, and we make some changes and send it back. We bounce it back and forth. So it's coming very quickly. It's in less than a month. If you have any ideas for bills that you think we should introduce, if you know there's a law that you think should be changed in some way, it should be eliminated, it should be added, it should be changed, you got to let us know soon, because we don't have a lot of time. And once the bill deadline passes, there's sometimes ways to get these things through with amendments, but it gets much, much more difficult. So if you have something that you're interested in changing in state law, you got to let us know soon.
Thank you very much. Is there anybody else that has any question or concern, idea? First of all, I want to thank everybody for coming. It's an opportunity for you to actually hear from the legislators what's going on and direct your questions or comments and concerns to them. This is where it starts. If you take a look at the booklet that was passed out on pages 2 and 3, that list right there is not everything. It's not everything, but it is a starting point. What changes occur in Connecticut occur starting right now, today. Your input to legislators is going to be important because they're going to hear what you have to say, they're going to go back and evaluate it. They already have some ideas as well, but they're going to put it together and prepare. Now, you heard the deadlines are very, very short. You're starting on January 4th, you get bills going on the 13th, the whole process starts back and forth. But if they have an idea from you now of something that needs to be changed, something that needs to be modified, or something new, this is where it starts. So having these type of meetings, I think, is very important. It opens up an opportunity for a dialogue to go back and forth. You can exchange numbers, you get some email address, you can actually talk to your legislators right here. So they do definitely listen. You heard tonight what the replies were, so I think that I heard that they were listening. Anything that you have, any idea that you have is not a bad idea. It's something that needs to be vetted out and processed through as they go through the whole process in the state of Connecticut. So we want to thank you for coming out tonight. You say you're going to have one of these a quarter, hopefully?
Hopefully. Sometimes when session gets started, it gets harder. So sometimes we'll do them before session and then right after session. And session starts January 4th. But if we can get women, we will. The problem is that we can schedule it and may at the last minute have to be canceled because they may call us in for house session, which we obviously need to go. So it gets a little bit more difficult when we're actively, I know we do work all year round, but when we're actively in session. So, but we will. And I know Representative Dubitsky does. We all try to be out there. We try to go to events. We try to be out there, so don't hesitate to come up and ask us a question. That's why we work really hard to be out there for you. We have sometimes office hours, which we'll set up at a coffee shop or something, and just an opportunity for you to come see us. But we freely give our phone numbers out, so you can call us, you can call our staff, and ask questions through that. So we really do, I know I can speak for both of us, work really, really hard to be out there for you and be available to answer questions. So if you have any.
Many topics tonight. What I was trying to get at for pages 2 and 3, and what you heard tonight, everything is connected. We heard the Department of Health saying that they're not getting enough money from the state of Connecticut, and if they don't get that money coming in, where does it end up? Either services increase or it goes on to the town. We talked about the same thing with Board of Education. If you don't get what you need, then something has to go, or something hopefully comes from legislators to help out. So everything is connected because the town budget relies on all of that as well. Everything we do relies on that. So I ask at any time you see a meeting like this, a town hall meeting, to try to get people here to attend it and ask those questions, because it's your money, it's your town, it's your state. So everything that you do ties in together. So I want to thank you all for coming in tonight. And there are cards up here from each of the representatives. You want to take a card to be able to get contact directly. And we thank you again.
I just want to take a minute to thank Kevin, because he's always a gracious host. He's always been very, very available to us. I call him, I don't think he ever stopped working. I've talked to him as early as 5, 6 o'clock in the morning and as late as midnight. So he is working hard to communicate with us. If the town has needs, he always reaches out to us. If there's a grant available or something where we can support him in any way, he reaches out. So we rely on him to reach out to us, and he does a really good job of that. So I appreciate that, and he's always very gracious in letting us come and speak with you. So thank you.
And again, thank you all for coming tonight. If you want to come up and get a card from any of the representatives here, help yourself.